Welcome to the Know Your Calling channel.
Okay.
And so we'll just have a little chit chat about the psychiatry branch.
All right.
Yeah. Can we have a general introduction about psychiatry as a branch?
Uh, Psychiatry as a branch is considered to be one of the minor subjects in the curriculum of MBBS undergraduation. And it's only when you enter post graduation that you understand psychiatry better. It deals with mental illness and it has a very wide scope. Most people don't know that psychiatry also caters to sleep medicine, sexual medicine, substance use disorders, and behavioral disorders, which are very common. So, mostly we associate mental illness with those people who are usually roaming around the streets, not taking care of their personal hygiene or being aggressive as such. But even simple anxiety or stomachache or headache can also be a psychiatric symptom.
Yeah, I agree. Like there's a lot of scope, but in the MBBS we're just not very privy with what it is like a subject. How do you describe the life of a resident? Like what are the timings and how will we get time for the hobbies and all?
If you are a person who is interested in doing several other things along with pursuing residency, then psychiatry is a very good branch which you should look forward to. The timings are usually the same as other branches. In normally most of the colleges in India, we have morning rounds. Then after morning rounds, we have outpatient department, that is OPD timings. Once OPD is done, then you have the follow-up round in the evening and the detailed history taking and all, and lectures or journal readings or any other case discussions which will follow in the evening, but mostly you are free by 8 in the night in most places in India. So you have the night for yourself to do what you want. So it's a good branch to enjoy your residency as well as study and know different things and different personalities.
Yeah, we have a notion that would be a little bit easier side, but after listening to you, I think it's not so. Like it is also a full-fledged, very hectic branch.
See, the normal notion regarding any minor branches during our undergraduate time is that just because we need to study a lot less for these branches in undergraduation, we have a conception that these are the easygoing branches or the branches which are uh, not very important per se in the hospital setup. But once you formally enter into a minor branch, also psychiatry or ophthalmology, ENT, skin, Dharma, that is. So then it is that when you realize that it is also like a full-fledged branch and you do work like your colleagues in medicine or surgery or obstetrics or orthopedic and all. Of course, you have much lesser emergencies compared to them, but you do have patient load. And the thing about psychiatry, which is unique, is normally when you see patients which are looked after by physicians or surgeons, the OPD transit time, which is the timing taken by the doctor to see one patient, it's hardly, on average in the country, it's less than 5 minutes.
Yeah,
But in psychiatry, the transit time is around 15 to 20 minutes per
yeah,
patient.
yeah,
So as such, you spend more time with the patient. As such, you interact more. You will have to be more vigilant, attentive, assertive, and patient while dealing with
yeah.
the patient. So that's the difference. But you do have workload and all, but it's not so much as that you will have sleepless nights or something. You have emergencies, But if you have colleagues in the department, your duties are distributed well enough, then you shouldn't have a problem in that. It's fairly comfortable. And if you are a person who enjoys nights or who stays awake at night like I do, so in that case, psychiatry is the gem of a branch, because most of the emergencies in psychiatry, they come during the night with acute psychotic episodes or alcohol withdrawals and all. So in that case, the nights are fun, filled with patients, you in your own time. So it's a mixture of both. But people who take psychiatry, they initially might be reluctant to like it, or they might feel overwhelmed by it at times, especially those people who have different expectations. So
Yeah,
if
yeah, yeah.
I if I have to elaborate on it, then those people who have some interest in the branch, who have patience to listen to people, and who have tolerance for taking insults of patients at times, they are the ones who should opt for psychiatry. And it's a fun loving branch. If you are interested in movies, psycho thriller movies, and all, which most of the people are. So,
Yeah.
most of the cases and the best movie plots, they involve a psychiatric illness or psychiatric angle or mental illness angle to it. Okay.
Yeah.
So, if you are interested in crime thrillers or movies or CID or something like that, then psychiatry is a branch which will fascinate you.
Interesting. Like, I am already, like, from the vibe of it, I'm already hoping that it's one of the best branches because, as you said, that there are no night emergencies. That is like one of the best things about psychiatry. So, other than that, what do you love about this branch? Like, psychiatry, other than the emergencies, what are the things like people should look up to?
One is you should be good at history taking. Most of the diagnosis which occurs in psychiatry is based on interviews, which is extensive interview of the patient as well as of the relatives of the patient. And if you feel that there is discrepancy, you can even take of a third party source. And also, basically, it involves you listening to people, taking down notes, and trying to understand them, their lifestyle, their motives, and it's like a psychological ride which you are going through along with the patient and its relatives. And it's
Amazing.
a fun filled, it's like a game sometimes that you are playing with them or they are playing with you. So it's fun in that way as well. And if you have interesting patients of, let's say, mania or bipolar disorder or something, then you'll have a fun time talking to the patients as well, who are so pumped up and high themselves. So it's a very innovative branch. It's fairly new branch professionally. Psychiatry has gained professional prominence in the last 10, 20 years, and it is now that people have started recognizing the perils of ignoring mental illness.
Yeah.
And now, the world over, psychiatry and mental illness is considered a paramount thing. In fact, uh, many people don't know this fact, but if you want to, let's say, be the prime minister of the country, then you require a psychiatric opinion as well that am I suit is this person suitable to be the prime minister of the country in terms of his mental health? So psychiatry is needed at various places which people are not aware of.
Yeah.
The general public is not aware of. Uh, it's a it's an emerging branch, and hopefully it will grow in the future.
Amazing, boss. Like these are the points which we were looking for. So, what are the some of the dark sides or cons of taking psychiatry?
wait for getting your first BMW or wait for so basically monetary benefits are not as much as what you might hope for in a physician or a orthopedic or surgeon or obstetrics and all. So uh, you will have to make do with some monetary difference with your peers who are in different branches. But the pro or the good side of it is you get a lot of time for yourself. So if you are happy with a reasonable amount of salary along with a good quality lifestyle, then psychiatry should be the branch for you. Especially if people are the easygoing types or who want a relaxed lifestyle. Of course, you will earn money, but if you are expecting yourself to earn as much as what a radiologist or a
Yeah.
surgeon or a physician would earn in the initial years of your professional life, then that is not going to happen. It will take time. You will earn a very decent and respectable amount of salary if in the interview you go on with what are the future prospects of professional areas or places in India where the scope of a psychiatrist are high, and we'll discuss on that. But uh, there are places in the country, especially North India, where de-addiction centers are sprawling, and
That
they
I've heard about this, that like the people owning de-addiction centers are having like a really rich lifestyle.
yes. So
Yeah,
those, if you join there, then the salary is at par with your colleagues in different other branches, which pays higher. But now government has started introducing one psychiatrist per district in the National Mental Health Care Program. So if you are willing to devote time and services to the government sector and to the poor of the country, like how I have chosen to do, so in that case, you are welcome to join the government and work under the government. So right now, uh, district mental health program is a very good thing which has been introduced since last 10 years or so more proactively. It has been there since a long time, but more interest has been generated in the last decade or so, and now psychiatrists are getting good job offers with handsome salaries under the government sector itself.
so it basically depends upon our personality. Like people who want a balanced lifestyle should opt for psyche, and somebody who's more monetarily inclined should like go towards the de-addiction centers. And what are, yeah,
It also depends on what you are expecting in life.
okay,
What do you want in life? If see in doctors, especially in people who have parents who are doctors, they already have an established setup in certain branches. Okay, and it is easier for their kids to enroll in those branches since they have a ready-made setup which they have to just join.
very true.
If you are a person who is the sole breadwinner of the family or whose financial condition is not so good, for those people, being a psychiatrist, you will not earn so handsomely. You will earn decent amount, more than decent, I would say, to have a luxurious lifestyle. But don't expect to start earning uh, 2 lakh, 3 lakh per month from the initial stages of your professional life itself. So, on average, psychiatrists do earn 1 lakh per month, which is a fairly decent amount considering our country's financial situations. And especially, there is a lot of scope in tier 2, tier 3 cities in the country. Most
Yeah.
of the psychiatrists which are practicing or which have been practicing since last 30, 40 years, they have been centered around metropolitan cities, and there are very few psychiatrists working in tier 2, tier 3 cities other than government setup. Of course, government employs people in certain districts, but there are no good private hospitals or private psychiatrists working in, say, tribal areas of the country or interiors of the country. There are very few. The ratio of psychiatrists to patients in the country is around one psychiatrist per 20,000 people, whereas the WHO guidelines suggest that that should be around one psychiatrist per 10,000 people in the country. Okay.
Oh,
So there's a lot of deficit of psychiatrists, of psychologists, of psychiatric social workers, of liaising officers. And basically, right now, psychiatry is too focused on the tertiary care centers. We need to spread out into areas where people are not so willing to come to the hospital because of stigma, because of discrimination, because of various factors, or because of unavailability of money or mode of transport and all. So we need to reach those interior lands and do good licensing and marketing.
yeah, very true. So, according to you, what will be the average number of years that we would have an established practice in both the metropolitans and versus the interiors of the country?
If you have one of your parents who is a psychiatrist and who has a established setup, then you will start doing well in about 2 to 3 years after completing your post graduation. If you
Okay.
don't have any of your parents who is a doctor or who is financially sound enough to support you for your own clinic or hospital or center, then it takes around 5 to 6 years for you to make a name for yourself, earn handsome amounts, and basically start establishing yourself as a psychiatrist. But it is easier for you to establish as a psychiatrist in a tier 2, tier 3 city than in a metropolitan city. And now, most of the doctors, the new ones, are spreading out in areas where hitherto there were no psychiatrists or there were very few psychiatrists. So it's a good thing.
Yeah, so we have touched upon most of the point like government versus corporate setup and the monetary aspects and the free time in the branch. Any of the highlights you would like to add from your side?
What do you wish to know? Psychiatrists are in psychiatry. We have fun activities as well, in which is a very good thing. We have movie clubs, we have book clubs, we have book reading, movie reading. We share reviews. We organize art and poster competitions, music shows, street plays. So, if you are someone who is interested in extracurricular activities, then psychiatry is a very good branch. Most of the colleges have various programs regarding information, education, and communication. IEC programs we call in medical sciences for every branch. In psychiatry, we have them extensively. So, if you are an avid reader and or if you like movies, then psychiatry is a branch for you.
Amazing. That is amazing to hear, especially after the rigorous 5.5 years of MBBS.
It's a very good branch if you uh, dive deep into it and just surrender to it. Don't think too much. Initially, you might have any person. Usually, people who take psychiatry, they take it out of a compulsion that they are not getting many other branches of their choices.
Yeah, this is one of the stigmas associated. Yeah.
If you ask me, I personally took psychiatry because I was interested in the branch, and it really was fascinating for me, especially because I am a huge fan of thrillers in movies and books and everything. So I
That
was
is one
all
of the personality traits that we were talking about, that
yes, and
somebody who is
also
inclined.
uh, because of psychiatric quiz and all in undergraduate days, most of the colleges have them. As in Gujarat, at least we have them. And there's a Gujarat level quiz, and the Indian Psychiatric Society organizes college level quizzes of undergraduate colleges in most of the colleges in the country. So I was actively involved during my undergraduate days in the quizzes and all. So it was a trigger for me. And my professor, my head of department, Dr. Bharat Panchal, he is a very well-known figure in the world of psychiatry in India. So it was a privilege for me to be under his tutelage. So that was also a
Amazing.
motivating factor.
Yeah, the institute and the people who teach us are always like they are a part of our personalities wherever we go.
Yes.
And what we'd like to know about the future aspects as well. Like, how is it
Okay,
shaping up?
so future aspects of psychiatry are very bright. Right now, as I said, if you are looking at for a government job, then
Yeah,
district mental health program has made it mandatory for the governments to have at least one psychiatrist per district in all districts of the country. So if you take the average number of psychiatrists which pass out every year in the country, it will be in the ballpark of around uh, 800 per year. Okay.
okay,
There are around 650 districts in the country. If you take a round figure, 700 districts in the country. If you say even 25%, 30% of these people join the districts, then most of the posts will be filled and the rest can join the private sector, which is booming now because of the advent of new treatment in depression, substance use. The addiction centers are booming in the country. Geriatric problems are going to rise in the country. Our country is getting older by the day. So by the time we reach 2040, at least 50% of the country will be above 60 years of age. So geriatric mental illnesses will be the flavor of the season in 10 years' time. So you can start if you have capital or if you have interest in it, then geriatric homes can be started. If you are not interested in staying in the country, if you want to go abroad,
yeah,
Australia, New Zealand, UK, US, very good countries, Canada for psychiatrists to go if you are planning to study psychiatry again there. Then, if you don't wish to study again, in all these countries, you have to give their entrance exams. You have to either work under a psychiatrist for 2 years, then pass an exam, and then you get a license for around 1 year to practice in that country. And if you are lucky enough to get a PR, then in the lottery system, you if you get the PR, you get the PR. Or if the hospital in which you are working, they are so impressed with your work that they want you to continue, then they'll recommend it to the government, and then the government takes the decision whether they allow you to stay in the country or not. But if Indian psychiatry degree is valid in Middle Eastern countries and African countries. So if you are interested in traveling and if you are interested in earning in dollars, then Middle East is a very good destination for psychiatrists, especially Dubai, Qatar. They have annual uh, exhibitions, trade fairs, medical fairs where they organize interviews. It's all the information is available on their websites of the respective country. You just have to be a regular user, just check once in a while, and you will get interview dates for different specialities, not only psychiatrists, for various other branches as well. They want doctors from India, Middle Eastern countries,
amazing.
African countries, since we speak English and Hindi, so it's easier for us to talk
Converse.
to people there. And Indians have a very good reputation of being very good doctors. In fact, the National Health System has 25% of their doctors as Indian origin or South Asian origin. So we are good and recognized internationally. So if apart from the Western countries, if you are interested in, if place is no bar for you, then Africa is also paying lots of money to any doctor, be it MBBS, MD of any branch. It's Ghana, Nigeria, Kenya, Uganda, Rwanda, Congo, Angola, Burkina Faso, Senegal, many countries you might not even have heard of, but they are paying excellent. fees to doctors from India. So that is also a place which you can try. And another thing which most doctors fail to think about is a career outside of medical sciences. Now we have reached a stage in human evolution where you need to generate income from various other sources as well. YouTube is a very good example of it. So you can start your own educational channel or any other YouTube source and all. Uh, Also, UPSC is a very good um, future prospect for psychiatrists or doctors of any branch. If you are interested in civil services and administration, MBA is a very good field which you can apply for if you're not interested in practicing what you did. So I think they should cover most of the things about future.
Yeah, and I guess one more thing is there, like you mentioned about geriatric medicine and practicing in different countries. So the fellowships and super specialization, I think that also holds a really good,
Yes, we
yeah,
didn't touch upon those points. If you, after your MD in psychiatry, if you are interested in super specialty, then there are three or four premium institutes in the country: AIMS, JIPMER, NIMHANS, Central Institute of Mental Illness in Ranchi, and Mumbai has two, three colleges which offer very good courses of fellowship in most of the topics of psychiatry, sexual medicine, sleep medicine, substance use, common mental disorders, suicide prevention, um, liasoning psychiatry, geriatric psychiatry, child psychiatry, forensic psychiatry. There are fellowship programs of 6 months duration or 1 year duration or 2 years duration in all these colleges. You can apply. It is a if there are more than a certain number of applicants, then they organize an exam or a test, which is a basic test, which should be easy for you if you have cleared your MD. Then clearing the test is quite simpler unless you are doing a super specialty course. Super specialty courses are very limited. In and there are hardly 150 seats of super specialty in psychiatry or neurological or allied fields. They are mostly in the most premium institutes of the country, and there's a super specialty, common super specialty exam, and a paper of your own specialty which you need to give to apply for super specialty in substance or child psychiatry, geriatric or forensic or various branches. You are hired by multinational corporations, governments for consultations once you do super specialty courses. Or we didn't talk about this, but academics is a very good option for a psychiatrist if you are interested in pursuing teaching. Then
yeah,
academics, there are many medical colleges which are opening up in the country. More will come up. Um, this government has an agenda of opening a medical college in every district of the country.
yeah.
So there will be posts for professors and assistant professors, additional professors and associate professors, senior residents and all, locum residents in the branch. So lot of scope there as well in the academic section.
Amazing, amazing. It was really nice to know about all the aspects of psychiatry and any of the closing notes from you.
And just enjoy and have a smiling face and love yourself and love the branch which you choose. That's it. And have
Very
an
true.
open mind and explore. There'll be lots of things to learn. There'll be lots of uh, things to understand. Be curious. If you are curious, if you are intuitive, and if you are a jolly person, then most of the things in life will be very easy for you.
Very true.
Cheers and party hard.
Okay, thank you so much.
Nice talking
And
to you.
same here, boss. Same here. Thank you so much for the interview.